Today we're going to be talking about an EEG scan. An EEG scan is also known as electroencephalogram, which shows electrical brain activity changes. The test is helpful in diagnosing brain conditions such as epilepsy, seizure disorders, and other brain conditions. Abnormal scans can result from tumors, bleeding in the brain, encephalitis, which is swelling of the brain, head trauma, behavioral changes, seizures, and brain death. The scan is more commonly used to diagnose seizures and seizure disorders. A seizure is a burst of electrical brain activity between brain cells that causes abnormalities in muscle tone, resulting in uncontrolled movements such as twitching, stiffness, or limpness. The scan is used by small metal discs, also known as electrodes, that are attached to the scalp. The EEG is important for the general public to understand because it is a key factor in diagnosing many problems of the brain. Not only is it done to diagnose and monitor seizures, but it also helps identify other health problems. Sometimes the EEG is also used to evaluate brain activity after a serious head injury or before a heart or liver transplant. So today, we talked about what an EEG scan is and how it is performed. This is what a person looks like while taking an EEG scan. The things attached to her scalp are metal discs that are called electrodes, and this is where the ends hook up to the machine. This is a closer example of what the electrodes look like when not on the scalp. These are the metal pieces and the plastic ends that hook up to the machine. This is an example of a normal scan. As you can see, these lines are similar to each other and fairly consistent. And this is a scan when a person is experiencing a seizure. This is normal in the scan, but as you can see here, this is when a person is first experiencing a seizure. This is a side-by-side comparison of a normal scan compared to a seizure scan. And as said before, the test can also test for sleep disorders. These first two lines is when a person is awake compared to resting, and the bottom two is when a person is in light sleep versus deep sleep.